Good morning. Our lecture today will be about the elastin and other extracellular matrix components. The objective of this lecture is to state the biosynthesis of elastin and its main role and character. Also, we list the glycosaminoglycan and what are their role in the body, and to understand what is meant by the proteoglycan and their the last objective is to discuss what is meant by the adhesive glycoprotein with examples. As a reminder, the component of the extracellular matrix is composed of structural protein, which is the collagen, elastin, and fibrin, and we have the water hydrated gel, which are the proteoglycan and glycoprotein, and we have the adhesive glycoprotein and its receptor, for example the Fibronectin, Laminin, Integrin, and other. In the previous lecture we talk about the collagen, which is a fibrous structural protein, and it's a major protein in the extracellular matrix, and it is responsible for the strength of the tissue. Today we will continue the extracellular matrix protein. The second important one is the elastin. It's also structural protein and closely linked with collagen. It is from its name, it gives elasticity to the tissue, and as a result it is found in large quantity in the tissue that have bending or stretching excessively. For example, it is found in the wall of the large arteries, it is found in the lung, also elastin found in the skin, tendon, and ligament. Usually the elastin are composed, the fibers of elastin are composed of a large mass of cross-linked elastin that are found together with another extracellular matrix protein that is called fibrin. The wall of the large arteries are abundant with elastin. Why? Because it allows it to undergo the continual deformation and reformation during the change in the intravascular pressure. In addition, the lung and the skin also need to be to have an elasticity, so that the elastin is found in large quantity. The elastin molecule can uncoil when we stretch any fiber contain large quantity of elastin. Then when we remove the force, then it returns to its original size. And as a structure, it composed, the elastic fiber have a core of elastin surrounded by microfibrils. The cross-link in the elastin is more than the amount or the number of the cross-link that is found in collagen, but the strength of collagen is less than that of elastin is less than that of collagen. The strength of collagen is much more than that of elastin. The number of cross-link is higher in elastin, and this give it more elasticity to the tissue that contain large amount of elastin, but the tensile strength is lower than that of collagen. The biosynthesis is somewhat similar to that of collagen. Also, it is synthesized as a precursor, and this precursor of elastin is called tropoelastin. It has two major types of alternating domain. One is hydrophilic and the other is hydrophilic. Being hydrophilic means it's rich in certain amino acid like lysine, alanine, while being hydrophobic means rich in another type of amino acid, for example, glycine and valine. The hydrophobic domain of the elastin is responsible for its elastic character. إذن elastic character المسؤول عنه is the presence of a hydrophobic domain in the molecule of elastin. Tropoelastin, after a few steps, is secreted to the extracellular matrix, and it will accumulate on the surface of the cell. Then, after it will be secreted, it will align with fiber of the extracellular matrix. The enzyme lysyl oxidase take the job of oxidation of certain part of the tropoelastin molecule, and this process will initiate the process of formation of the cross links and follow out by formation of a three-dimensional network. This process is similar to that happened in the formation of cross-link of collagen. The cross-link in elastin is similar to that of collagen, and it is catalyzed by the same enzyme, which is lysyl oxidase, and there are more cross-link in elastin than that's found in the collagen. Elastin have a special character or structure formed from the cross-linking. There is a special structure called the Desmosine. It arises from the lysine for side chain, and it is specific only for elastin, and it's found in the elastin and can be detected in the urine or in the plasma or in the sputum sample, and we can use it as a sample or a marker for excessive elastin degradation when we suspect that some patients have a disease related to this defect. For example, in chronic obstructive pulmonary disease, we can measure the amount of the desmosine in any of these samples. The other major protein in the elastic fiber is fibrillin. Fibrillin 1. It serves as a template or scaffold inside the elastic fiber upon which the cross-linked elastin is deposited. Fibrillin may be decreased secondary to skin aging and secondary to excessive exposure to UV light, and also we have certain inherited disease when we have a mutation in the gene that code for the synthesis of fibrillin, especially fibrillin 1 gene. It will result in a certain syndrome that is called Marfan syndrome. Marfan syndrome is a syndrome that results from the mutation in the fibrillin 1 gene. The mode of inheritance is by autosomal dominant mode, in which if one of the parent is affected, this is enough to transmit the disease to the next generation. The mutation, either there be decrease in the quantity of the fibrillin protein. We say that the fibrillin is found inside together with inside the elastic fibers, and it acts as a scaffold or a template upon which the elastin lay down. Okay, so this mutation in the fibrillin gene, either we have decrease in the quantity or the quality of the produced fibrillin may be affected. The tissue that most commonly affected or severely affected by this mutation is the tissue where we have a large amount of elastin. For example, the aorta, because it contains large amount of the elastin, and also in the skin, and in the ligament, in the tendon, in the eye, and in the lung, all will be affected by this defect on this mutation that will lead to abnormal quantity or quality of the fibrillin. In Marfan syndrome, there will be a skeletal, cardiovascular, pulmonary, and ocular organ damage. Usually, the patient with Marfan syndrome are taller at all age than would be predicted. This tall stature is the result of the overgrowth of their long bone, and this will lead to a characteristic feature in case of Marfan syndrome, in which they will have long leg, a long arm, and long digit. Because of ligament laxity, in this condition, the joints are hypermobile, and patients complain from joint pain. Also, there will be chest wall abnormality, and the hallmark is ocular hallmark is displacement of the lens from the center of the pupil. And if you found a patient that have displaced lens in the absence of any traumatic event, you put in mind that this patient, together with other manifestation of the disease, he may have a Marfan syndrome due to defect in the fibrillin gene that is part of the elastic fiber and act as a scaffold. The other category of the extracellular matrix component is the glycosaminoglycan. They are heteropolysaccharide chain composed of disaccharide repeat. The disaccharide is either N-acetyl glucosamine or it is the N-acetyl galactosamine. We have many types of the glycosaminoglycan, and the distribution is different. The concentration differs in each tissue. It could be chondroitin sulfate, chondroitin 4 sulfate, or chondroitin 6 sulfate, and keratin sulfate, which is found in the intervertebral disc and in the cornea. We have the dermatin sulfate, which is mainly found in the skin, lung, and tendon. Also, we have the hyaluronic acid and the heparin and the heparin sulfate. The glycosaminoglycan is characterized by being a negative charged molecule, and by being negative charged and have extended conformation, this will lead to a high viscosity of these molecules. When we put them in any solution, it will give the solution a high viscosity. Why? Because of its extended conformation. Because it is branched and polysaccharide, so it has a high viscosity when we put it in any solution. These glycosaminoglycan are found either on the surface of the cell or in the extracellular matrix. In addition to the high viscosity of the fluid where they are found, also they have a low compressibility, and because of these two features, this makes it ideal for lubrication, especially in the joints. The other feature is that they are rigid, and this rigidity gives a structural integrity to the cell, and also can give a passageway between the cell, and allow them for the migration. So they are characterized by being highly viscous. If we put them in a solution, in any aqueous solution, it gives a high viscosity because of its conformation. It have a low compressibility, so it makes it ideal for the lubrication of the joint. It is also rigid, so it can give structural integrity for any tissue they found in high concentration in it, and also it can allow the tissue for the communication and migration of the cell. And as we said, we have many types. The most popular, and we hear about it always, is the hyaluronic acid. It acts as an lubricant and shock absorber. Why? Because it has a very large volume, molecular weight is high, so it can displace a large volume of water and make this an lubricant, a good lubricant. The other one is the heparin, and the heparin have a role in prevention of coagulation in the blood. It is found or abundant in the granules inside certain type of cell, that is the mast cell that line the blood vessel. We know that the release of heparin from the granule inside the mast cell will occur secondary to any injury. When heparin enter into the circulation, it will lead to inhibition of blood clotting. It will form a complex with antithrombin 3, activate it, and inhibit the serine protease of the coagulation cascade. And this phenomenon have been used, and it is the base of the use of heparin injection for anticoagulation therapy. هذا البيس بنستخدمه according to this its property and function, that is natural function, على أساس it can be used as a heparin injection as an anticoagulation therapy. This is the main glucosaminoglycan. طبعا we have a lot of, but this is the main and the well-known, with the hyaluronic acid, the heparin sulfate, the keratin, the dermatin, and the other. The other category of the extracellular matrix is the proteoglycan. Proteoglycan are the same as glucosaminoglycan, but the difference is that they are attached with a protein. So the proteoglycan is glucosaminoglycan plus a protein. The percentage is of about 95% glucosaminoglycan plus 5% protein. All the glucosaminoglycan can bind to a protein and be converted to a proteoglycan, except for a hyaluronic acid, which is not attached to a protein. These proteoglycan have a lubrication effect, and also they prevent the diffusion of large molecule by increasing the sieve, the resistance sieve for the big molecule, and also it's a site for binding of certain signal molecule and help in the adhesion of the cell and their migration. So the proteoglycan are in fact glucosaminoglycan plus a protein. واحنا نعرفها الجلوكوزامينوغلايكان are the keratin sulfate, heparin sulfate, dermatin, except for hyaluronic acid, which is a glucosaminoglycan, but it isn't found bound to a protein, so it doesn't form a proteoglycan. Their function is the proteoglycan for lubrication effect, site of the attachment of the cell, site for the attachment of signal molecule, and also prevent the diffusion of large molecule by increasing the pressure resistance sieve. The other component is the adhesion glycoprotein. From the name, they are very important as a glue. It's a site for attachment. Example of the glycoprotein are the Fibronectin, Laminin, the Chondronectin, the Integrin, and the Osteonectin. All these are the adhesion glycoprotein that are part of the extracellular matrix. They are the site for the attachment of the cell, and also it can help in better alignment of the component of the extracellular matrix. The first glycoprotein is the fibronectin. Fibronectin is a large molecule, and it acts as a scaffold or template for the deposition of the extracellular matrix component. It is important in blood clotting as it's linked to fibrin and help in the process of clotting. Also, it's important in wound healing as it guides the cells to the wounded area, and then the process will. So fibronectin is important in blood clotting, in wound healing, in cell growth, adhesion, and migration, and also for the angiogenesis. The other adhesive glycoprotein is the laminin. Laminin has two binding domains. So one side is attached to the extracellular matrix and the other domain attached to the receptor of the cell. So it has two binding sites. Laminin is an adhesive glycoprotein, has two binding sites, one for the extracellular matrix and the other for the cell surface receptor. It can bound different molecule, example collagen and the heparin. The other one, adhesive glycoprotein, it is called integrin. It is very important. It is called the molecular glue of life because of its adhesive characteristic. It is called the glue of life. It is found, its position is transmembrane glycoprotein. So it is found transmembrane, so it allows the cell to attach to the extracellular matrix. Inside the cell, it can activate the tyrosine kinase, and this will result to signaling cascade will be activated. What are the matrix metalloproteinases? Matrix metalloproteinases are a group of enzymes. They are involved in the breakdown of matrix of the extracellular matrix. Is this a normal process? Yes, it is part of the remodeling of the extracellular matrix. If it is within the normal range, it is a part of the normal remodeling of the cell. It is very important during certain conditions, for example in bone remodeling and in neovascularization. What are the stimulus to this process? It's activated by certain growth factor and by cytokines. Does the extracellular matrix change with age? The answer is yes. With age, the amount of the protein that is formed in the extracellular matrix is less than before, and the activity of the matrix metalloproteinase that break down the protein increase. So the amount of the protein that are being broken down is more than the protein that is formed. Also, the amount of both collagen and elastin will decrease in the tissue, so there will be less elasticity, less strength, more stiffness in the tissue, and even the collagen that is formed is less organized. So, and because being less organized, the attachment of the cell to the extracellular matrix will be weak and have a negative impact on the overall structure. In addition, we have unnecessary collagen. A cross-link will accumulate in the tissue, and this will affect the organization of the tissue and eventually the function. The amount of the cytokines and growth factor that enhance the activity of the matrix metalloproteinase enzyme that break down the matrix will increase, and so the enzyme will be more active and it will break the matrix. Overall, there will be reduced in the biomechanical support of the extracellular matrix with age. The summary of this lecture is that the extracellular matrix provide the structural support that held the cells together to form different type of tissue, and it is mainly composed of structural protein, specialized protein, and different proteoglycan. The structural protein that is mainly found in the extracellular matrix are mainly collagen and elastin, and each have a different function. The specialized protein in the extracellular matrix are fibronectin and laminin, and also each one have a different function. Elastin will form a cross-link by a mechanism that are similar to that is found in the collagen, but it have a unique structure, which is the Desmosine, and the highly stable cross-link of elastin is very important. Why? Because it is responsible for its elastic character. Fibrillin is also found as an interspersed in the elastic fiber. Part of the elastic fiber elastic fiber are the fibrillin protein. It forms as a scaffold so that elastin can lie on it, and it's important also for the proper function of the elastic fiber, and a deficiency of this protein result in a connective tissue disorder that is called the Marfan syndrome. The glycosaminoglycan composed of various disaccharide. The major constituent of it is uronic acid and a hexose or a carb that composed of simple carb of 6 carbon. It could be galactose, or sometimes could be a galactosamine or glucosamine, and sometimes some of the glycosaminoglycan have sulfate in their structure. And the most important glycosaminoglycan are the hyaluronic acid, the heparin sulfate, the keratin sulfate, the dermatin sulfate, and the chondroitin sulfate. While the proteoglycan are glycosylated extracellular matrix protein. They are composed of one or more glycosaminoglycan attached to a protein, and they have a brush-like structure. The molecule of the proteoglycan are extremely large and have a main function as a lubricant and shock absorbing property. It gives this property to the tissue where proteoglycan are found in high concentration. And thank you.